Hello and welcome everyone to our School of Nursing Connect. We are so excited for all of you to be here. My name is Bethany. I'm currently one of the freshman admissions counselors at APU. I also did go to APU and we have some amazing guests here, some of our faculty, coordinators as well. And then we also have a current student here to share their experience with you and just to answer any and all of your questions about nursing. So again, welcome. If you're just joining, my name is Bethany. I'll be moderating the event. We have some amazing things planned. And I'd love for all of you to look down at your bottom bar. There is a Q&A button you can click. And that is what we will be mainly looking off of today. So feel free to submit any questions about nursing and we will be able to answer those live for you. We're very excited for you to be here and to get to answer your specific questions about our program. So again, feel free to utilize the Q&A box. We would love to answer your questions. And without further ado, I'll go ahead and have everyone introduce themselves. So I'll start with Dr. Eslin and then Dr. Paul and then Barbara and then Amanda. So go ahead, Dr. Eslin.
Hi, everybody. Welcome and thank you for joining us. My name is Dr. Patricia Eslin. I've been faculty at APU since '06, so 15 years. Prior to that, I've been an oncology nurse pain management specialist at City of Hope. And I've taught across programs here at APU from early on in the GE 100, in the first semester you start here, all the way through master's comps, and in the undergrad program 212 and 312. I've also taught on different campuses, Monrovia, LVN to BSN, and High Desert 2+2. But I think we're talking about the undergrad program here tonight, but that's a little bit about what I do. Also, I am the chair of the admissions in the undergrad program.
Thank you so much. And then Dr. Paul, if you could introduce yourself next.
Hi, everyone. My name is Ruth Paul, and I'm an adjunct faculty here at Azusa Pacific. I have been here since 2007. I teach in the undergrad mostly. I have done a little bit in the ELM. I teach clinical. I've been a clinical instructor in pediatrics, and I teach pediatrics as well as leadership. So I see the students more towards the end of their time here at Azusa. Also, I'm in the doctoral program and I'm a faculty advisor there. And just as another note, I work at Children's Hospital. And so I see the students in the clinical setting, and I also see them get hired at the hospital. We have a lot of nurses from Azusa Pacific, so it is a really great program.
That is great. Shall I go next, Bethany? Beth?
Yes, that is perfect.
Great. I'm Barbara Wiltsy, and I am the program coordinator for the traditional undergraduate nursing program. I am typically your first contact just in conversation, and once we go back on campus, which we're really looking forward to in the fall, we'll be seeing you more often in the those of you that are applying, that have already applied and been accepted for the upcoming fall. So I tend to be an advisor, a student advisor, and just a liaison between you as a student and faculty and other finding resources for you as well. And we're excited to have you here.
Perfect. And then Amanda, go ahead.
Hi, you guys. I'm Amanda Pamantuan. I'm a second-year nursing major with a psychology minor. I'm in my Med-Surg 2 rotation, but going on to my restorative rotation next week. And I'm also the SNAP Director of Internal Affairs. So SNAP is our student nurses club at APU for APU. And I'm also a Code Blue mentor where I mentor a nursing student, usually a freshman since I'm a sophomore.
Excellent.
Fantastic. Thank you all so much for introducing yourselves. Again, if you're joining us, please feel free to utilize the Q&A box below where you can submit your questions. We already have a few, so thank you so much for submitting those. And now we will go ahead and start with our Q&A portion. So firstly, I would love for all of you to really answer this question. We can go in the same order. So Dr. Estlin, then Dr. Paul, then Barbara, and then Amanda. But in your own experiences as faculty, and then for you, Amanda, as a student, what are some of the distinctives of APU's nursing program?
Well, I like to think it's faculty, small class size, the clinical sites we go to, depending upon the course. I really love the faculty I work with. It's like a family, truly. And I think it makes a big difference when the faculty are cohesive and are all on the same page about student success. And for example, for the course I teach, the primary course I teach for 312, which you take in your third semester nursing semester, that's when you're in the program, is nursing management of patients, and they're complex patients. So we go to City of Hope. It's got a lot of oncology and stage life processes such as liver or kidney, HIV, AIDS. So it's very complex. It's more than Med-Surg 1. So I would like to say those things. It's really the students, the faculty, the clinical sites we get to go to, and the quality you get. Mm-hmm.
I'd like to tag on to that. I agree about the quality. I see the students more towards the end of their time at APU, and the growth that they have and the professionalism is just amazing. And they really embody what it means to be a student at Azusa Pacific. And so you really could see the difference and just see how mature they are, especially when you see them amongst other nursing students. So it really is a combination of things and just the amazing potential that the school brings out in people.
Mm-hmm. Well, and I agree with that. And as a staff person, I'm not a faculty, but boy, I have watched as faculty have reached out to students individually, make sure that they're on track, to see if there's anything they can help them with, if there's some struggles, and just working side by side with the students. And I'll tell you, the APU nursing faculty are second to none, and I just admire all of you guys so much. And the fact that students have the opportunity to go into the hospital early rather than, and it's the direct entry idea, first of all, is of course knowing that you're in the program right away, which is an amazing thing. But the other thing is, when you start the nursing program, you will enter your clinical rotation in a normal, COVID has shaken us up a little bit, but normally you're going to enter your nursing, your rotation in the hospital and be in the hospital by week 7, which is really a great opportunity to start what you love doing already, what you have been waiting for. So I think that is what really makes APU School of Nursing stand out.
So for my regards, I think APU really stressed a God-centered education, which I was looking forward to. And how Dr. Estlin also mentioned, there is a small class size. So with that regard, the professors are really able to concentrate on the students and their success in each class, which I really appreciate, especially during times as these, because virtual learning has been difficult, but also manageable at the same time. Mm-hmm. And APU also provided wonderful clinical rotations. Since my freshman year, I was able to go to Kaiser Baldwin Park, Cedars-Sinai Medical Center in Beverly Hills, and I just finished my rotation at City of Hope in Torrey. And those are all formidable hospitals, which I've been very grateful to learn from. And I just think APU has such a wonderful faculty and student body for nursing, and it's a really great program.
Thank you so much, Amanda, and everyone else for sharing. Okay, so we are getting a few questions about the cohorts and how those work. So Barbara, could you kind of explain the difference between the spring and the fall cohort, and then also the size for each?
Okay, so we accept about 100 students each fall, and that group of students are placed randomly in either the spring or the fall cohort. So the students that were admitted in the fall of 21, that's the upcoming fall semester, they have been assigned either the spring 2022 cohort or the fall 2022 cohort. The students that are assigned the spring cohort, they will get take their general studies and their nursing prerequisite sciences, which are anatomy and chemistry and organic and biochemistry. They'll take those in the fall of 21. And then when they finish that semester, we typically check grades, and they've received in their letter, it did say the expectation for the criteria is a minimum overall 3.0 and then a 2.7 in your sciences. But we're anticipating that will happen. And so we're anticipating that they'll be able to start in the spring of 2022. The nursing courses actually start in that semester for them. And so then they'll take another science with those nursing courses, and then that will be their semester. The students that are assigned the fall 2022 semester, they have that extra spring semester to finish up sciences, maybe, and some other general studies courses. And then they'll begin their semester for nursing in the fall of 2022. The difference is one is the fall 2022 semester is an extra semester. The benefit of that is they have that extra semester and a summer to fulfill more classes, which lightens their load. And nursing is such a rigorous major, as you know. And so it can be really beneficial. Of course, the benefit of the spring cohort is that it's a 4-year program. So that's it in a nutshell. So
thank you so much. That really helps explain everything. We are also getting a lot of questions about just the general nursing student experience, which is why Amanda is amazing and here, so she can address those. But I'd love to ask you, Amanda, we have some questions just about your general nursing experience, and then how rigorous are the courses, and how are you able to maintain good grades, but also balance having a social life at APU?
I was prepared for this question because I would ask this question as well. With balancing your social life and nursing school, you need to know how to manage. Time management will be your best friend, and a planner will also be your best friend. You need to, because it depends on each semester how many units you are also taking. So this semester I'm taking 17 units, whereas with my freshman year, I took around 14 or 15 just to like ease into the college experience. I was able to get pretty good grades and still manage my social life because I knew how to divide, like, set these amount of hours for this class, set these amount of hours for this other class, and then set these hours for like friends and like being able to hang out with them. Also, studying with your friends is a social thing as well. I study with my friend, and it's been really helpful, especially nowadays since we're on Zoom. We just FaceTime all the time just to keep each other accountable. And with how rigorous the program is, you need like time management, and your professors will always be there to help you as well. We have office hours, we have tutoring. You can also sign up to have a mentor who can guide you through the program, and you'll always have like resources around you to help.
Amazing. Thank you so much, Amanda. Okay, well, we also have some questions, some people asking about APU's Nclex pass rate. So whoever would like to answer this, I think Dr. Eslin.
I think
Go
I know
ahead.
that right now. So if you look at the BRN website, I don't know if that's a parent asking this question or what. The BRN looks at APU nursing as a whole. So that means any pre-licensure program such as LVN to BSN, entry-level masters, because they come in with, they get their RN license while they're in that program. And the regular TUG, the group here at APU, the undergrad program, as well as the High Desert 2+2 program, they lump all those together. So if you look on the BRN website, it's a little bit lower than if you just know what the undergrad, traditional undergrad is. And right now it's 97.5. Hello. Sorry, not sorry.
Yes.
Yes,
Yeah.
an amazing percentage. That is unheard of, people. So if you're here, you already know APU is a fantastic program. Not only that, but what Amanda said earlier, it's a Christian education that you're receiving, which is huge as a nurse, right? You want to be able to holistically care for your patients spiritually, but also physically, and having excellence in both of those areas is very needed. So thank you for sharing that. I appreciate it.
It is a rigorous program. It does take work. I saw some questions related to COVID. The work hasn't changed because of COVID. In fact, I think Amanda might agree that it seems like more, but because there have been issues with clinical sites, hospitals have decided, especially in the spring and the fall, last spring and fall, they didn't want students there because the numbers were so high, they couldn't have students there. So some of our clinical sites were displaced. And to continue the program, we modified things so that they were doing some experiential learning and other activities to get hours to pass the course and move forward in the program. That being said, they might have had to do some makeup clinical hours in different ways with serving hospitals, whether it was a vaccine clinic or testing clinic or whatever we were offered. We took advantage of that. So for example, right now in the course I teach, we were doing, the BRN came through with waivers. Instead of having, we would be required to have 90 clinical hours. We were able to get by with a 70, which really translated to a little bit less with some other orientation type hours for the site. So it all still works out that the student is getting 90 hours attributed to the course, but they might not all be in person at the clinical site, and that's out of our control. But we didn't shut down. Some schools have shut down. We've managed to stay open. And things are looking up.
Yeah.
And adding on to Dr. Eslin with how online, like the activities we've been doing, honestly, I actually like them because I have a debrief for one of my online activities in 2 hours. And we get to learn about diseases that I may not see in clinical. And we will be able to go through that nursing process of like giving them a certain medication and everything. And I think although it may seem like a lot of work, it does benefit us towards our education and learning.
Nice.
Perfect. Thank you all so much. We have some questions kind of going off of that about clinicals specifically and the experience. So the first kind of tier of it is, where are students doing their clinicals? And then can you kind of describe the rotations and how this is fitting into a weekly schedule along with the classes? So Amanda, if you want to share, and then I know Dr. Paul, you have some students at CHLA who are doing clinicals, and I'm sure Dr. Eslin as well. So you all can chime in as well.
Okay, so my freshman year, I went to Kaiser Baldwin Park, and then unfortunately, due to COVID, we were displaced. And then in the fall, I was placed into Cedars-Sinai Medical Center for my med-surg rotation. And this semester, I was placed at City of Hope, which is a cancer hospital that deals with like leukemias, lymphomas, everything. You guys will all learn about it. And next week, I'm going to be at Rancho Los Amigos in Downey for my restorative rotation. And with doing clinicals weekly, it's honestly pretty manageable since it's once a week. With like our coursework. Of course, it's gonna be a tiring day. You're gonna want to take a nap after clinicals before you go study for your tests. But the nurses, like from my perspective, each nurse has like given me like wonderful opportunities. Yesterday, I got to help with a rapid response, and like they were also supportive and like willing to teach. And I think clinical is where you're going to be able to like work with your actual hard skills and like being able to do a Foley catheter, which you guys will learn, and like putting in IVs, hanging medications. And also your patients will be so gracious towards you because you are a student, you are learning. And I just love, like, that's what makes like the nursing program so great at APU, is just like the wonderful hospitals they were able to provide for us. And it's just so, yeah, I just love my clinicals. And also your friends in your clinical groups, you're gonna like, you become a family also with your instructors. They will like push you to learn, and it's just so great.
Some of the clinical sites we use, I mean, they're all over the place in the San Gabriel Valley, LA area, even some in Orange County, depending upon the course that it is. For 105, which is your first nursing course, fundamentals, currently with COVID, they're not going into the clinical site, but we were using Foothill Presbyterian, the Kaisers, Methodist, Huntington. I'm just trying to throw some names out there. Presbyterian, Whittier Presbyterian, Cedars. Well, that was for 212. I think I already said Huntington. As you move up through the courses, obviously you have other hospitals that come into the mix. For example, in 312, third semester, we throw in oncology. So we have City of Hope, and we've had PIH, but we lost them this semester for COVID reasons, but we'll get them back in the fall. For restorative, they were using Casa Colina, but that was been closed from COVID purposes. They didn't want students there. So it's been Rancho and Huntington, I think.
And Cedars.
And Cedars. And then community and mental health. Well, community was using community sites. Mental health, a variety of sites, but some of those got really hard hit with restricting students all the way out to, we were using some places out in San Bernardino, I believe, for the undergrad program.
Yes.
And then urban health, well, urban is urban. So you're in the city, inner city, you're doing quite a bit of things in the city. Peds and OB, so Peds, obviously CHLA, I think they were using Huntington. Where else, Ruth, Dr. Paul?
So it's Huntington and CHLA right now. Huntington isn't taking students, but they should be soon because they just reopened their PEDS unit.
Yay!
Yay, I know, really. And the other really cool thing that happens in the rotations, and I'm sure Amanda can speak to this, is carpool groups start to form.
Yes.
And you all, you know, and so you get to know who's in what carpool group, and they all drive to clinicals together. And that is part of that whole bonding experience that you will have as well. So that's also a lot of fun. I've heard about a lot of carpools over the years.
Just gotta be careful with COVID and keep your bubble small. If you're a roommate, fine, but if you're not, no. Oops, I'm
Well,
sorry.
hopefully in fall it won't be that
That's
big of an
right.
issue.
And then OB was Methodist Hospital, Huntington, but I think they closed this down. I think they were also using one up in Glendale or Verdugo Hills, right? I think it was
Verdugo Hills.
Verdugo Hills. and Queens, Queen of the Valley, which is now Emanate, critical care, Huntington,
St. Jude, St. Joseph,
Jude,
but
St. Joseph's.
yeah, and St. Jude's will be opening again. They
Yes, it just
had to
opened.
close.
So
But
we're
St.
really,
Joseph we worked at.
yeah, we're really all over the valley and into LA. And some of these hospitals are quite well known and respected. I mean, CHLA, the students crave to get there, and
Yes.
City of Hope and Cedars, and really, they just want to be in clinical settings just like you do, and that's why you're asking these questions.
Perfect. Thank you all so much. Okay, so we do have some more questions. I think we're having a few in regards to switching cohorts. So I just wanted to have Barbara answer this. Are students able to request to switch cohorts if they're placed in either one and would like to be in the other one?
They're welcome to request that. They can shoot me an email. They have my email on their letter. The cohort right now is assigned and placed. So we don't know if we will have an open spot in the other cohort if they want to switch from fall to spring or even from spring to fall. What we need to do is have about 50 students in each of those cohorts. So after April 1st, we will figure out our numbers and should be able to identify if anybody can move cohorts. So then we would notify students. So they're welcome to let me know if they'd like to do that, and I'll certainly make note of it.
Great. We do have some more questions in regards to classes. Specifically, what does the first semester look like at APU in the nursing semester? And then are we assigned our classes and times, or do we get to choose? And I know, I believe Dr. Eslin knows about these classes.
Well, I think Barbara would be better to answer.
Okay,
Sure.
perfect.
Yeah. Well, so students have what they call a course map or a progression schedule. And the first semester will be classes that for sure, depending on which cohort the student is assigned. So students who are assigned the spring 2022 cohort will need to have that anatomy and the chemistry course, which are each 4 units. They have a lab component. If what I'm expecting is for a face-to-face class, praise God, and they'll be on in-house. We have been doing those online this semester, so we can get creative if needed. The other course is the GE 100, which is the leadership course, is my understanding, and it's a great introduction to college life.
Wait, what did you call it?
GE 100. It's not called that anymore.
No, it's GE 100, but it's not leadership.
Oh, it's not considered a leadership class?
No, it's a Writing 1 course where you learn about the workings of APU and all those resources they have. But you also, we have key topics, and we've been running on the soft skills right now. So nursing soft skills. And so there's assigned readings and a lot of writing because you're learning APA, which is the format that we use. So I like teaching it. I've taught it 2 fall semesters, and it's only offered in the fall, and you have to take it. I've enjoyed teaching it both times.
That's been
Adding on to Dr. Eslin, that class is pretty great. I met my best friend in that class.
Oh, that's so awesome.
And she did teach us like APA, and APA will be your best friend as well.
Well, the topic too is nice because you're all with your nursing cohort. So and the faculty that you're going to be having will be focusing on the aspects of nursing. So the other courses that you might take, we typically require write 1 course, which is your English, your freshman English, and a general psychology course. Well, often students have the AP courses completed for the writing and the psychology. And if you have a score of 3 or better, you can waive those classes, and then you can pull in another class if you'd like. from another semester. So for instance, you might decide to take communications or ministry course in that first semester. I understand, and I think Bethany might be able to speak into this a little more, that students are actually selecting their own classes now. Is that correct, Beth?
I'm not sure within the nursing program, but specifically at APU, the great thing is that when you register for classes, you'll meet with your academic advisor or your success coach,
Right.
which is what we call them.
Jessica, yeah.
Yes,
Posey.
Jessica Posey. She will also be your best friend. She's amazing. And she will help you with your nursing courses and make sure you know how to register and sign up for everything.
Okay. So she'll guide them in their registration if they have some questions. Good.
Exactly.
Yeah, because I know at one point we were registering students actually, and that was years ago, but then we've now moved into allowing them to kind of take the reins. So that's awesome. Does that answer the question?
Yes, I believe so. Maybe if Dr. Paul or Dr. Eslin can name a few just titles of nursing classes, and that can range from any of the years, but just so students are kind of aware of all the different types of classes that they'll take as a nursing major.
Well, the first semester in the nursing program, so not your first semester at APU, but when you're in the nursing program, you start with 105 fundamentals, you have pharmacology, and you have health assessment. And you'll have a class or two with that to make up the mini classes you're taking that semester. Second semester is Med-Surg 1 and Pathophys, and one more, nutrition. Third semester is Med-Surg 2 and restorative. Those are the only nursing courses you're taking in third semester. So you're taking other like microbiology if you don't take it during the summer. My tip is if you are in, I forget which cohort it would be, but if you have 312 and 313 coming up in a fall semester, take micro during the summer, please. Your life will be a lot easier. That way you can live, eat, and breathe micro all summer, and you'll have room for something else in the fall with 312, 313, because those classes are short 8-week courses. And it's like I push play and I spew out you get the content like a tidal wave, and before you know it, the course is over. And then you start 313. So you're either in 312 in the first 8 weeks, or you're in 313, and then you flip-flop and take the other course you weren't in. In fourth semester, you do the same, but you have mental health and community. And you also have writing 2 course, which is 306. So you flip-flop the community or mental health the same way you would do with the 312 and the 313. In your fourth semester, you have urban health, and that's usually your, correct me if I'm wrong, Barbara, that would be the study away semester if there's study away.
Yeah.
So it's urban health or it's study away in fourth semester and other courses. Fifth semester, no, I'm getting confused. And then when you have peds and OB, it's either peds or OB. It's another flip-flop. So those 8-week courses just come in like a tidal wave, and you just gotta keep your head above the waterline and ask Amanda. It's totally doable. And then when you get to critical care semester, it's critical care. I think I skipped one with peds.
No, it's urban, peds OB, and then critical care. So
yeah, but
good.
with the peds and OB, you're also
I have
taking
403 leadership.
Yes, I was going to say that, the leadership course, which is 403.
Right.
And then in critical care semester, you have critical care and
ethics.
and ethics, and also a preceptorship if places open up more, which they will by then. So.
Well, I do know that you mentioned study away, and I know that is a huge aspect of applicants applying to APU. So I'd love if Barbara, if you could maybe touch on the opportunities to study away. I know we have China, Norway, and then South Africa. And you're able to study away and take your nursing courses there. So
Yeah, so study away opportunity, you apply like typically by February 1st of the year before you're going to go. And there's the fall and the spring semester. It is taken, I believe it's either your 5th or 6th semester, or your 6th or 7th semester, something like that. And it's on the progression schedule to have either that, as Dr. Esslin mentioned, either that or the urban experience. So the study away is either South Africa, China, or Norway, like you said, Beth. And the students get to select their first, second, and third choice. And then they're placed. You want to, we don't just take students that have had study abroad experience. So students really need to pray about it and consider what that means as far as going away. I would suggest that students take a look online. We have some wonderful testimonies of students that have studied away, great pictures and all of that. And I'm sure that's on the website. I don't know exactly the title of the website, but you can really find that at the AP website. And it's a full semester. We allow a full semester. You go for South Africa, you go pretty quick, like within the first 2 weeks, I think. For China, it's typically around right after Chinese New Year. So you have about a month and a half still here at Azusa. And Norway, I'm pretty sure you go pretty quick with that one too.
fantastic. Okay, so I just want to make sure we're getting through all our questions. So let's see here. We have some questions about nursing students having free time to do sports. I know, Amanda, you might have a few friends who do sports. When I was at APU, a lot of my nursing friends did do intramural sports, were able to not necessarily play at a collegiate level at APU. I know we do have some, but it is more rare, but we do have intramural opportunities and ways to get involved. I've had students that are in honors college. Nursing majors are typically the largest population in honors, so very doable as well. I've also had friends that are resident advisors or work on campus. So again, nursing majors, if you're applying, time management will be a huge life skill for you to learn in college. Just like Amanda mentioned, it's very important to schedule out your time for your classes, your time for your free time, and your time for work if you're going to want to have a job. So I don't know if you want to add anything else, Amanda, to that.
So I don't do the intramural sports, but I do work out, so it's like close enough. I do have friends who are in like the intramural volleyball, and friends who are in the honors college. I have a friend in the fall cohort above me who's in the swim team for nursing, for APU, and she says it's manageable, and she works, I believe, as well. So yes, time management and just being able to like know when to take your breaks and when to study, when to do this, when to do that is just will help you succeed in the nursing program at APU.
Yeah, students need to check with their coaches of those programs. We've had some track students and some cheer students, if there still is cheer. And but check with the coaches, and certainly shoot us an email and we'll look into it. And the coaches are welcome to connect with us to see if it will work.
And it really comes down to time management, mastering your time management and having a good schedule and adhering to it.
Great. Okay. Let's see. We have a question about the kind of the best alternative if a student did not make it into the program. So I don't know who would be best to speak to this, but we do have some other pathways at APU. Just briefly go over that.
Barbara probably has already.
Yeah. So we have opportunities for transfer students that are offered out of our High Desert campus or our Monrovia site. It's the 2+2 program. It is designed for students that already have about 2 years of college completed. So students would typically go to a community college and get those units completed and then apply for the 2+2 program. The other option is our entry-level master's, and that's designed for students with a bachelor's degree in another field. So students that might maybe have another interest in say allied health or psychology, almost any major, you can, if you decide to come to APU and to do that other major, then you can we will make sure you get your sciences done, and then you can apply for the entry-level master's. That program allows you, you would about a year and a half before you get your actual RN license, and then you continue on to get the master's. And at that point, you would typically get a job as an RN, and you would have that while you're finishing up your master's. So it's kind of the best of both worlds in a lot of ways, especially if you have a strong interest in another area. So those are the two main options that we discussed. We also have LVN to BSN and RN to BSN. Students, they check the website for more details about that too.
Yes, our website does have a lot of information. I'll go ahead and send that link after this, but another question kind of in regards to that, Barbara, just really quickly is, how long would it take to finish the nursing program if the student has a nursing associate's degree by the time you enter as a freshman? So would that be 4 years or would it be around 2 is the question?
The traditional program is either 4 or 4.5 years without a hitch. If a student already has an RN license or their associate degree in nursing and they can sit for that RN license exam, then our strong suggestion would be to do the RN to BSN program, because that's a 2-year program and it will fulfill the need for the BSN. So that's something to really look into.
I'd like to address the question that I see. What if you fail a semester? I want to break that down to a course. So if you do not pass a course, you would be required to repeat it. And for nursing courses, correct me if I'm wrong, Barbara, it's one nursing course fail, and then your progression is halted once you're in the nursing program. Correct?
Yes, and you would repeat that one course, and we would anticipate that you would not fail another one, but if there's a second failure, then you would not be allowed to continue. So that's the way that works as far as nursing courses. As far as sciences, you also can have one opportunity to repeat one science, and we would anticipate that you would do well in that second retake of the science, but there won't be a second opportunity for that.
And there was another question along these lines. Would I need to maintain a specific GPA or get a certain score or higher on all tests? So if you break it down by course, in the course, you need to end up with a C or better. And in nursing, that's a 73% in testing. So let's say you bomb the first test because you don't know how the instructor tests, but then you make it up on the second and third and or final, whatever that course is testing. If as long as you end up with a 73% or higher in testing percentage for that course, you'll pass the course and move on. So that's how that works. We do have guidelines when you get the letter for acceptance. We have guidelines that you need to meet the parameters or criteria to stay in the program. It's a cumulative 3.0 in the program once you're in the program. And the sciences, you need to get a 2.7 or higher. Now, there are students that get below that 2.7, and then we have conversations and there's remediation. And ultimately, you get through all of your sciences, you might actually end up with just a little less than a 2.7. And there are conversations, and you can either continue the program, or if it's too low, you might be asked that you can't continue the program. It just depends. So I think we answered those two questions.
Yeah.
Great, thank you guys so much. We have another question. Let's see here. Okay, so we have some students that are sophomores, and just one student is asking advice on making her application stronger. So if you would like to speak to that, I think Barbara.
Sure. So the most important thing is to start with is those grades. You want to have your biology and your chemistry course done from high school with an A or a B. Your high school transcript, of course, the higher the better as far as your GPA overall. And it's I don't know how SAT or ACT scores are going to play into all this. But if you do have that opportunity, we would be looking for, you know, a 1200 or better on the overall SAT, and then maybe a 26 or better, I think would be good, a good healthy score on the ACT. So if you have that opportunity for combination of math and writing, or math and English, if you have an opportunity to volunteer at a hospital or some sort of a healthcare facility, that would be great. We understand with COVID and everything, a lot of volunteers are being turned away, but you may find that your local hospital or somebody that you know has an opportunity for you. So I would suggest that you look around and see where you can find a place where you can, and this is a great opportunity too, to make sure that nursing is really, truly what you want to do. So any kind of that would be great. We love to see students that are well-rounded. So if you participate in anything with regard to leadership in your school or your community or your church, that's always helpful. Certainly don't burn yourself out. And just, yeah, that would be a really good, strong candidate.
Perfect. We do have another question specifically about classes before starting at APU and if that's needed, but we have a few in regards to anatomy and or microbiology. So if we could clarify if freshmen should take college level anatomy, if that's recommended, or biology before starting at APU.
So college level anatomy, for those of you that were assigned the spring 2022 cohort, we suggest college level anatomy in a summer prior to coming. We do that because we have heard back from students that, boy, I wish I'd taken anatomy before I came so that I could have taken physiology in that fall semester. And then I wouldn't have had to take physiology with my nursing courses. So that's kind of why we suggest it. Honestly, we rarely have students that are able to do it. And I'll say that just basically they're challenging to get those courses at your local community college, or either they're not offered or they fill up because students that are already in the community college and have priority snap them up. Plus, you want to make sure they're transferable anatomy courses. Whatever course you do want to take in the summer, if you did want to kind of check into that for other classes as well, if you felt like, oh, I'd like to get psychology out of the way, make sure that whatever you do try to take transfers. Not all community colleges are created equal in the sense of some are quarter system, some are semester system, and you also want to make sure it's the correct type of anatomy, just because some of the anatomy courses we don't take them the same as we would ours. So they don't transfer equally over. So you need to confirm that with your admissions counselor, or whoever the person you're going to be working with once you've made your deposit and so forth. So we don't require it, and we certainly we don't see it as often as we think we might, but just a few students are able to get anatomy in the summer typically. I hope that helps.
Yes, very helpful. Okay, another question. Let's see. as an incoming freshman in the nursing program, we have some questions about grades. And kind of, I know Dr. Eslin touched on this, but basically this question says, could you explain a little bit about grades? I know that grades in college are different from high school since there are no longer AP courses. So maybe touching on the grading scale, Dr. Paul, you are more than welcome to as well.
Did she hear you or?
I did, but I don't know that I'm the right person to touch on grade.
Okay.
I'm probably not.
Oh,
Okay.
okay.
Well, we have the standard, you know, A through F, and I need to pull it up, but the percentages.
I'm pulling my syllabus right now. I'm
They're
looking for it.
listed on.
Okay, they're so, you know, there's A minus, but not A plus. Then there's B plus, B minus, and so forth and so on. So when I said obtain 73% or above, 73 is the lowest you can go and be able to pass a course, and that would be a C. 70 to 72.99 would be a C minus, and that is not passing for a course. Now it might be slightly different in the sciences. They have a slightly different grade schematic, but that's how it works for the nursing courses. And I think, was that the question?
Yes, that is perfect. Yes, and then I know at APU in general, grading skills kind of vary by professor as well. So ultimately, just reach out to your professor if you're struggling. APU professors really want to help in any way that they can. That's why they work at APU. And I know Amanda's nodding her head, she knows as well. The faculty are there to support you as a student and to see you thrive.
So tests are pretty clear cut. The test, it's either right answer or wrong answer. But when you get into assignments, we typically have rubrics, criteria that guides the clinical instructors or a person who's grading the assignment to give X amount of points. So that's how we do the assignment portion. And some of them are just complete it or don't complete it, and it's a checkoff.
And also with regards to like tests, like there is this one test like I didn't do as well as I hoped, and I just like went to review it with my professor, and then they were very like we talked about it, and they're like, oh, I see your point of view, I can give you credit for this question. So
Oh,
like also being able to like connect with your professors, because they're also they want you to succeed. No one is setting you up to fail at APU. They want you to succeed as a nursing student. And yeah, like with the assignments, it's very manageable because they do give you like clear cut instructions of like what you're supposed to complete and like when you're supposed to get it in by.
Great. Okay, so we do only have a few minutes left, so I want to try to get through these last questions. We have a question about minors. So any minors that you all would recommend for the nursing degree? I know Amanda is a psychology minor.
Spanish or psych, for sure. I've seen students with a theology minor.
Okay, so a lot of
work really well.
Perfect. I do know we have a Spanish for healthcare class, which is very helpful. I'm sure all of you think so as well, especially in the healthcare field.
Well, especially in Southern California.
Correct. Okay, another question. Do you think the nursing program at APU helps build a lot of friendships with both peers and professors? Amanda, if you want to speak to that.
So I'm actually friends with all of my clinical instructors. I always shoot them a message, and I'm also planning to ask like for letters of recommendation, and those will also be your best friend when you apply to hospitals, because a lot of hospitals find APU very prestigious, especially like places like City of Hope, because they also have a lot of APU new grads in their units, and Cedar Sinai. my sister like also is still friends with her professors after like graduating. So yes, like your friendships with your professors and your classmates, they're gonna be like lifelong, because your professors just want to like be able to become the best nurse you can be.
Great. Okay, another question we have. What math classes are nursing students required to take at EPU? I don't know who would be best to answer this one.
I'm
Barbara.
sorry. What was the last part? Sorry.
What math classes are nursing students required to take at EPU?
There should come in as with math, what we call math proficiency, which means either a particular grade in their ALEX, a score, I should say, in an ALEX test, or their calculus in high school, or an AP score. And that being said, we don't really require any other math class at APU except for our nursing stats, which is later in the program. Sometimes students will have an AP stats class, and if they would like, they can request that course waive the nursing stats, but really the nursing stats is a really great class. So anyway, and it's also helpful because that particular is an upper level stats class, so it will help them to have enough for a master's program if they are planning to apply later. Anyway.
Great. Okay. Well, I know we almost got to all of your questions. Thank you so much for sending those in. If you have any additional questions, feel free to reach out to your admissions counselor. We can also direct you to Barbara as well if they're very program specific questions, but we would love to be able to help you wherever you are in your application process. For nursing majors that have been admitted for the fall. Oh, go ahead, Dr. Eslin.
I saw a question. Being Catholic does not affect your chances to get in.
I'm Catholic.
There you
So,
go.
yeah.
Yes, we have many denominations at APU, specifically 55. So we do love to see diversity in our denominations as well. Great question. But yes, we would love to help you in any way that we can. As far as kind of wrapping up our time, I'd love to basically just ask Amanda, maybe Amanda, if you could share kind of like one of your favorite memories being a nursing student at APU, or kind of the general, your general experience as a nursing major and what led you to choosing APU. That would be awesome.
So when I was applying for schools, APU was definitely in my top choices. And I have a sister who attends APU, and I saw like how much she like grew as a person, not only as like a nursing student, but as a person, because the connections you make with your patients, especially your patients, they will change your perspective for the rest of your life. Your professors, your friends, and your clinical instructors, they all contribute to how you grow as a person and as a student. And from what I've heard from nurses in the past at at hospitals I've been, they're always like, APU nurses, like they've been so like in the holistic sense of like caring for their patients. And that's why we're so highly sought after when we graduate as well. And I think in the program itself, I've just really appreciated the education I've been given and how supportive like the faculty have been, even during COVID situation. They were quick to like give us the hours we needed or be gracious for whatever situations we had. And your clinical sites, like they're the best of the best, and it's just wonderful opportunities, and it's just such a great school as well. Your friendships is just like, I'm gonna probably like be friends with these people like until we're old and retired. And yeah, Also your
Sure.
professors. It's just a great program overall. I would recommend it to anyone who's interested in nursing. So yeah.
Well, thank you so much for joining us, everyone. I just do want to honor all of your time. Thank you to Dr. Eslin, Dr. Paul, Barbara, and Amanda for all of your insight and everything you shared about our nursing program. Again, we are so excited to welcome all of you. If you've been accepted, we would love to see you on campus in the fall. We're very, very excited and gearing up for that. Also just wanted to let you guys know, if you have been accepted, the deadline to deposit is April 1st. So feel free to contact admissions if you have questions about that. And we will definitely see you next time. We're so blessed and honored to have this time with you. And thank you so much. Bye, everyone.
Good luck.
Bye. Bye, Amanda.
Bye.